one minute before. And good morning, everybody. Welcome to this Personnel Ways and Means Committee meeting. I call this meeting to order. First item of business is the approval of minutes. Is there a motion to approve the minutes?
There are no additions or corrections. I move to be accepted as submitted.
Support.
Been moved and seconded. Any comments or corrections? All in favor signify by saying yes.
Yes.
All opposed, say no. Next item, which won't be on your agenda, is there was a late minute insertion to the agenda, item J on the second page. I'd entertain a motion to amend the agenda.
So move. Support.
Been moved and seconded. Any comments or questions? All in favor, Commissioner Van Doren.
Well, we can either explain it then, but these came in just yesterday and they're running close to the deadline for signing. And they also comply with our new resolution for reading it 2 different times because it's grant money that's coming in and grant money going out. So
Thank you. Any other comments or questions? So it's been moved and seconded. All in favor signify by saying yes.
Yes.
All opposed, no. The agenda is amended. Next item would be public comment on any agenda item. Is there public comment on any agenda item? There will be a second public comment time at the end for non-agenda items. Seeing no public comment, we will move on. There are no rules issues to take up today. The next section is board appointments. We have 2 people recommended for Region 2 Planning, Larry Gould and Jim Van Doren, and for Wellwise Services, Keith Williams. Is there a motion to recommend these appointments?
Support.
Been moved and seconded. Any questions or comments? All in favor signify by saying yes.
Yes.
All opposed, no, and I am voting no. Thank you. That'll move forward. Next, we have the employment changes to consider. Administrator Murphy.
In your packet, you can just see the new hires that we had for the month of March, as well as the individuals who have terminated for one reason or another. And the last grouping is the individuals who have moved from one department to another. Answer any questions if you have them.
Seeing no questions, thank you. I would ask you also to bring us up to date on the employee anniversaries.
The employee anniversaries for the month of April, we have Judge Shadler, who has been with us for 43 years, all the way down to the 1-year anniversary of Miguel Betts with the Sheriff's Office. And those are your employee anniversaries for the month of April.
And of course, I'd be remiss for not extending our condolences to Judge Shadler for the unexpected passing of her brother. Thank you for that. Is there any other personnel business? Moving on, we have a request for a position change. Administrator Murphy.
Yes, as we bring in attorneys, whether they're in the public defender's office or in the prosecutor's office, and we are waiting for them to pass the bar, we will put them in a position of the very entry level of an attorney, which in this case is a public defender 1 position. With some of the rearranging that's been going on in the public defender's office, it was brought to our attention that we do have Dylan Rocket, who is an assistant public defender 1. He did pass his bar back in May of 2024. And the request to move him into the public defender 2 position had not come over to our office. So acting chief public defender Michael Dagar Margosian did make that request to bring him up to the pay that he should be at this point, as he is carrying the same caseload as all other public defender 2s. So what we are looking at is to recommend the reclassification of the assistant public defender 1 at pay grade NU 7549 to an assistant public defender 2 NU 7559.
I'll move.
Support.
Been moved and seconded. Any questions or discussion? Seeing none, all in favor signify by saying yes.
Yes.
All opposed, no. Matter advances. Next issue before us is the reappointment of a replacement for our current equalization director, Administrator Murphy.
As you may or may not be aware, Equalization Director Marshall DeLong will be retiring at the end of this month. And as part of that process, we did advertise for her replacement. Now, I will indicate that advertising for an equalization director and getting qualified candidates is a very difficult feat, as not a lot of people are making that a career these days. So when we posted it, we did receive a couple applications of two very qualified individuals. Also had a couple phone calls from individuals who had created larger organizations that would like to enter into a contract with us. But as we looked at Lenawee County and what we want, we really would like to have an equalization director here within the building. So we did interview both candidates. There is a memo attached to your packet indicating all of the steps that we went through. And this position is actually statutorily required, and the Board of Commissioners are the ones that actually make the final appointment for this position. So what we did is the hiring team did interview both of the candidates, and we had a candidate that just seemed to rise to the top that we became very excited about. We did check his references. Those references were very, very complimentary towards him and the work that he has currently been doing. And so in the end, we are recommending that you recommend to the Board of Commissioners the appointment of Thomas Trey Clements III as the new Lenawee County Equalization Director at pay grade NU 7558, the start step, which is $43.26 per hour or $84,371 per year. And in addition, Mr. Clements is here. He got here a little while ago and is available to come to the podium and answer any questions that you may have of him.
Would you like to come forward? Yep, is the green light on, then you're good.
Good morning, Commissioners.
Good morning.
My name is Trey Clements. I have about 6.5 years of experience in assessment administration with both the local assessing level as well as the county equalization level. And I just wanted to introduce myself, and I'm here if you have any questions for me.
Any questions? Any comments? All right, thank you. I appreciate you submitting your application. If there's no other discussion, I would entertain a motion to recommend this appointment to the full board.
So moved.
Support. Moved and second. Any other comments? Seeing none, all in favor signify by saying yes.
Yes.
All opposed, no? Great. Thank you, sir. Administrator Murphy?
Just for clarification, for our candidate's sake, do you want him at the Board of Commissioners meeting tomorrow? Because usually with a unanimous vote, these things go on the consent agenda. And I wanted to make sure that you were comfortable with him not being in attendance if he had other work that needed to be done.
Thoughts? I'm fine with that. Everybody else good with it?
Fine with it.
Speak now or forever hold your peace. Very good.
Thank you.
Thank you. Next, we continue with Administrator Murphy and the finance reports.
Okay. I'm gonna say this probably for at least one more month. The finance reports, we currently are in our audit process, so there may be a few more adjustments to be made. And also, once I am done with the finance reports, our finance director, Mr. Zamolzak, is going to present you with the first set of budget adjustments for the year. So we'll go through these kind of lightly, but keep in mind that things are going to be changing over the next month or two. So these reports were run on March 31st, which means technically are about 25% into the year. On the revenue side for the general fund, you can see that we are currently at about 7% of the budgeted revenue, which is just over $2.8 million. Now, keep in mind, the revenue does not come in equal portions throughout the year. It would be nice if it did, but the majority of that revenue will be coming in later this year into the fall as the property taxes come in. As we look at the general fund expenditures, a few pages back, we are running at about 23% right now of the budget on the expense side, or just over $9.7 million. As we move on to the fund equity changes report, Just as a reminder, these are grouped into a lot of different funds. The first fund category is the governmental funds. This includes general fund, special revenue funds, your debt service funds, your capital project funds. All of these funds together bring us to the total government funds to date of just over $9.8 million in revenues, with 20.9, almost $21 million in year-to-date expenses. As we move on to the fund category proprietary funds, we have our enterprise funds, which are more like our business-related funds, as well as our internal service fund. The proprietary fund totals the year-to-date revenues of $6,380,000, with our year-to-date expenditures of almost $6 million. So the grand total of all of your funds, year-to-date revenues are at $16,115,000, with your year-to-date expenditures at almost $27 million. If you have any questions, I will attempt to answer those.
Any questions for Administrator Murphy? Not, then Dan, I'd invite you to come forward and give us your update on the 2026 budget adjustments.
Good morning, everybody.
Morning.
We've got our budget adjustments, first round here for the 2026 fiscal year. And to some extent, these are required because of our record-setting earliest budget adoption last year in September. And all of these are grant related. So what we're looking at is column 1, which is basically the before adjustments, and column 3, which are the after. And the middle one is what we're proposing as budget adjustments. And you can see that as you go through all 4 pages, those adjustments net to 0. And so what has happened is we've received updated grant revenue, which came about before the grant was actually approved or authorized by the granting unit. And this now updates our budget to reflect those adjustments. I do want to direct you though to the very last adjustment on page 4, Department on Aging. You will see that they are using $2.5 million plus of their fund reserve to fund our MSC project, a transfer of $2.5 million to support the kitchen, and then also $62,000 for purchase of a vehicle. And the reason this is happening in this manner is they're a September 30th end of year budget, so the timing is a little bit off. And they had this money, the $2.5 million earmarked in their 2025 budget, and they had received a grant of $62,000 from Wellwise Services, which they were unable to use until after their September 30th budget end to purchase that vehicle. So that money was rolled into their fund, basically their fund reserve, and now we're pulling it back out of there to reflect the changes in their 2026 years. Beyond that, I'll be happy to answer any questions. I did want to introduce in the back our budget analyst, Tracy Stace, and then next to her is our accountant, Matt Turgeon, who both of whom are instrumental in implementing these changes as well.
Thank you, Dan. Any questions?
So move.
Been moved and seconded. Any further comments?
No?
All in favor signify by saying yes.
Yeah.
Yes.
All opposed, no. Thank you. Thank you,
Thank
Dan.
you.
Thank you to the whole team.
Yes.
Next, Administrator Murphy will brief us on the 2027 budget calendar.
Every year, we present you with the proposed budget calendar. These are the timelines that we are hoping to hit in order to present you with a budget. And we are using last year's deadline that, as I believe Mr. Zamolzak just said, our record-setting approval of a budget. We are going to use that again as our timeline. So what we're asking for today is to recommend approval of the 2027 budget calendar.
Oh,
So
been moved and supported. Any comments or questions? All in favor signify by saying yes.
Yeah.
Opposed, no. Thank you. Next, we have Shelley DeLong, who will become giving our 2026 equalization report. Welcome.
Good morning. So within your packet is the equalization report, where we've reviewed the assessment rolls from the different units. And with that, after reviewing it, we've recommended the adoption of the equalized value for 7,063,348,540. And that's total real and personal. We do have some disabled veterans that will be coming off, but not, some are already off, but we still have a few that have been coming in. So that will change a little bit, but that was an approximately 5.86% increase in SEV. And we have an approximate 4.29% increase in taxable value. So I need you to place this on file and adopt it, and that's my recommendation.
Thank you. Do I have a motion to that effect? So moved?
Support.
Moved and seconded. Any questions? All right, all in favor signify by saying yes.
Yes.
All opposed, no? Thank you. Thank you, Shelley. Appreciate it. And continuing this vein, we have a couple actions with respect to the 2026 tax rate and then the delinquent tax revolving fund. Administrator Murphy.
This is called the L 4029. This is the document that does establish the millage rates that will be collected in the upcoming year. So what you can see is that there was a rollback of about 0.991 that has been applied to the millages. And we are looking at a 5.4 millage to be collected under the operating. A Department on Aging has their millage, the medical care facility has their millage, and then we are continuing with the Veterans Relief Fund. So what we're asking for today is to recommend approval of the 2026 tax rate request, the L 4029, and authorize the board chairman and county clerk to sign same.
For a motion to that effect?
So moved.
Support. And moved and seconded. Any discussion? All in favor signify by saying yes.
Yes.
All opposed, no. Thank you. And Kim, if you would, on the delinquent tax revolving fund.
Yep. So every year, the Board of Commissioners provides the ability for the treasurer to be able to borrow from the delinquent tax fund as they begin to pay back the local units to make sure that they are kept whole. And then we then begin to collect on the delinquent taxes. This amount, this resolution that is attached indicates that the tax revolving fund be authorized in an amount not to exceed $750,000 as of June 1, 2026. I will indicate that even though we had this resolution in the same amount last year, the treasurer did not need to exercise the ability to make that, to borrow that funds. So we just have this just in case so that we do not have to go out and borrow from a bank.
Thank you.
So moved.
Support. And moved and seconded. Any other comments or questions? All in favor signify by saying yes.
Yes.
Opposed, same sign. I will take these next two. We do these every year, do we not? We have to do our remonumentation and research activities. So we have a agreement in front of us that's in your packet with Manick Smith and another with Sheridan Surveying for the remonumentation and remonumentation. Was that really monumentation, and remonumentation research agreements and monumentation? Got it. It's, yeah, let's hear it for bureaucracy. Is there a motion to this effect? It's been moved and seconded. Any discussion? All in favor signify by saying yes.
Yes.
Opposed, no. Thank you. And in a similar theme, we have have a peer group for the surveyors, and the request before us is to recommend approving resolution 2026-06, appointing Michael Bartolo, David Erickson, Joseph Fenical, Glenn Richards, Scott Warnke, and Stephen Young to the 2026 peer group and approving the peer group contracts.
So moved.
Support. And moved and supported. Any further questions or discussions? All in favor signify by saying yes.
Yes.
Opposed, same sign. Next, I'd ask Ms. Zisk to come forward. As you know, we've spent an awful lot of time over the last 2 years working on the opioid settlement. And Francine has put together a presentation to talk about the recommendations of the committee. So Francine, I turn the floor over to you.
Good morning. It is a privilege to come to this point where Bridging the Gap Subcommittee has provided recommendations. I am going to discuss what the recommendations are that the committee came up with. Background, in 2023, we completed a community needs assessment. It says completed in 2025. We used some of that data is actually completed at the end of 2023. We utilized local data, national data, needs assessment, and summary and recommendations. If you recall, at the board meeting, it was presented in November of 23 about a lengthy presentation of what was discovered. Along with that, we also had a town hall meeting and 2 book reads in the community to bring awareness to substance use disorder and to get a feel from the community of what was needed. Just a highlight of some of the drug data that was found in the community needs assessment. We utilized from January of 21 to September of 23 of what drugs were obtained by Michigan State Police. We took these, every drug that was collected, to a unit of measurement of a single substance. 3,217.15 units of measure. 77% of these drugs were stimulants, including methamphetamine, cocaine, and crack cocaine, which was different than what had happened 5 to 7 years ago, and that was found in the community. 9% were opiates and narcotics. So of the opioid settlement funds, we were starting to call this substance use disorder as because the drug started to change and what was seen in the community. We also went with the medical examiner's report, substances found in the body at the time of death. 30 had a stimulant in it, 15 opiate-based, and 5 other substances. We conducted 175 assessments. Some of those, I think it was 32 or 34 that were in the Lenawee County Jail. The rest was from the community, the town hall meetings, and people who were doing this work. So the alarming drug data wasn't exclusive to Lenawee County. It's what we were finding on the state and the national level, that stimulants were growing what was found in the body at the time of death. What we saw in a decade of differences is back a decade ago, there would be prescription drugs found present in the body at the time of death. Now the growing trend is they're illegal drugs. So we're removing, which is showing that the opiate settlements and all the laws that were presented for drug prescribing are working. And now they have been moved to illegal substances. So in this community needs assessment, what was found with the participants' information, according to people who had lived experience suffering from substance use disorder, these were the ranking of what was needed in the community. According to community partners and community members, this is what was found. With the information and what was happening in the community, it was recommended that we create a recovery housing committee. That committee was appointed. It began in February of 24. We brought in 6 different housing groups that deal with people with substance use disorder. And the committee, at the end, after listening to the housing groups, did not want to move forward and fund recovery housing. The committee wanted to come up with what are the gaps in the community? What did the community needs assessment not meet? And what was needed best served in Lenawee County? We came up with Bridging the Gap Committee. It was appointed and began in March of 25. An RFP was created and was released for proposals with Exhibit E documents. Exhibit E is the driving force document that dictates where the opioid settlement funds should be spent. Bridging the Gap meetings, we received 27 proposals. We heard 23 of those proposals over 7 months. Some people rescheduled, some people withdrew, and some people just did not show. There was a recommended programs for a holistic approach that would best serve Lenawee County. For the monies that has been received thus far, 1.5 million was allocated in this rounds of RFPs. Through the committee meetings, there were surveys done, a lot of conversation, and the following is the recommendations from what the committee came up with to best serve Lenawee County. The first is with Catholic Charities. The program is called Seeking Safety. This program provides an education program to assist parents with substance use disorder, CPS. It's an evidence-based program conducting 10 individual sessions, groups of 8-week sessions, up to 12 times per year, was in their RFP proposal, and that's what they stood and stated that they would accomplish. As you can see, every one of these programs also has what is presented and services under Exhibit E. This program will be for 2 years. Their funding request was for $72,040. Parkside Counseling, they have 3 proposals that are recommended to be funded. The first one is exclusive for youth prevention and intervention programs. These services include individuals, family, and group therapy. These are the Exhibit E that they had multiple sections that this covered. Program is for 1 year, $251,390.50. The second proposal was Reset for Success. This was to connect and motivate success also for youth. Alternative to suspension program, and this is collaborating with the school districts to pilot programs to connect parents and youth involved to connect that and give them services with counseling and therapy with other alternatives. Program for 1 year, funding is $144,420.64. The third proposal for Parkside, engagement for all, especially for adults who have no insurance, commercial insurance, and do not qualify for traditional substance use disorder services through CMH funding. Exhibit E is listed there, program for 1 year, funding of $36,633.20. U-Turn Health. This is a out-of-county program, and it will be done through tablets and online video-based education. This is evidence-based, person-centered program to support individuals with not only opioid use disorder, but substance use disorder. This access is online, several hundred videos. They do have a workbook format that they can use as well for a lot of different coping strategies. U-Turn Health will be provided for anyone in community along with their families. When they first submitted an RFP, it was for justice impacted people only. However, that was revised to include everyone in the community, being inclusive for everyone who is in Lenawee County and their families. This program is for 2 years, funding of $189,498. Family Medical Center program to support medically assisted programming, adding 45 to 50 new county residents who are suffering with substance use disorder through MAT. These are the exhibit that is funded, they meet the requirements under. Program is for 1 year of funding of $200,000. Impact marketing. This marketing was for media campaign. Impact marketing came in when they did their presentations, they provided a lot of examples that they've done marketing for, specific for counties that made a difference to reduce overdoses and reduce substance use disorder in their community. If you're looking for a specific idea or niche that you want to do, they will blend that with all of the programs that will be serving or be funded under the opioid use disorder monies in Lenawee County. And they will target that and work exclusively to come up with efforts that will help and assist. Here's the exhibits that it's covered under. Program is for 1 year, $99,273.40. Inmar, this is a program that provides kiosk stations for medication, along with placement, including mail-back programs and sharp containers. As we do have drug take back, there was a lot of discussion regarding this. The thing that became very interesting is they have mailer back programs that people who are in rural areas that can't get somewhere can mail their medication back, which includes sharp containers that are not available only for certain 2 times a year. This program is for 1 year. Funding is $44,250. McCullough Vargas and Associates, proposal is for peer recovery coach. The expansion is to serve in peer recovery for incarcerated people, unhoused, domestic violence, and medical care connected to treatment and support. Their programming was written for 1 year. However, if they do not expend the monies, they will go up to 5 years to utilize the $165,000. Lenawee County Sheriff's Office, proposal for funding to acquire medication for MAT services in the jail to provide classroom-based education to the inmates regarding their SUD, MAT, and MOUD program. Program for 1 year, funding of $75,000. As you hear is a list, and the final total is $1.277505.75, coming under the 1.5 million, which will give area in the future if there is any other programs that can be negotiated and to be funded that can assist with any of these gaps that were not recommended. And with that, Commissioner Martis, would you like to end this as you served as the committee chair?
Well, certainly. And first of all, we have to say thank you to Francine. The volume of data that Francine had to work her way through, the length of these proposals, the intricacies of Schedule E is something that a judge would have to sentence me to deal with because it's just not my wheelhouse at all. And Francine did a fantastic job putting this together and helping us all understand it and managing all the details. And I also want to mention the members of our committee, Judge Todd Morgan, Health Director Monica Hunt, Deputy Medical Examiner Sarah Palmani, local businessman Gary Clift, former State Rep Brana Colley, Commissioner Terry Collins, Sheriff Troy Bevere, myself, and Community Mental Health Board Member Tim Kelly. I've said this several times. I'm just a remodeling contractor that tried to pay attention in school. These people brought tremendous depth of experience and a real commitment to this. We were meeting twice a month for a number of months, and I think the second meeting of every month was actually 2 hours long with back-to-back presentations from these folks. Tremendous lift, complicated thing, and Francine and the team have done a fantastic job. The focus that we placed on is, because initially the previous group had a focus on housing, and it became apparent that that was not a direction that we were going to move forward with. Jim started then the Bridging the Gap Committee, and I picked it up in July, I think, or August. Had to hit the ground running, get to know the team, but it was clear that people wanted to make sure the resources were being committed in any way possible so that we're connecting people who can bring help to people who needed help. That we not saw that as the most important item. And there's a number of ways to do that, understanding that we have some people who are school age, some people who are out of school, some people have insurance, some people who don't have insurance, some who are justice involved, some who are not. Some, I mean, there's a whole range of issues. And then of course, their family members who have another host of issues. So trying to find a way to plug all those gaps in a way that we haven't had the resources to do before has really been our challenge. The next thing is we were pretty confident we did not want to invest money in bricks and mortar and that kind of thing, and medically assisted treatment, which some of you may not know. There's certain drugs available that if you have an addiction issue of some kind, these things can blunt the effect of medication or of the substances for a number of days. Some of them are quite cheap, some of them are quite expensive. But there's been an issue with finding funding for that. It was obvious that was a component that we were going to need to look at in some form. And then finally, something we don't think about, but we have existing programs plus new programs, but they're no value if people aren't aware of their existence. So we realized that some kind of marketing campaign was going to be important and play an important role in this. And I have to say we had 2 very good proposals, but the group that we went with I mean, I'd encourage you to go back and watch the video. I mean, talk about an impressive presentation, and marketing is only as good as the content that's created by the creator. Everybody can use a web service, everybody can put it on Facebook, but if the content isn't effective, and this provider brought meaningful numbers showing a change in outcomes in the communities where they've been doing their work. So that's how we kind of settled on these issues in the proposals that came forward. And actually, there's quite broad agreement on virtually all these. We also understand, however, with humility, that this is our first attempt at this. I mean, we have 1.5 million that we're working with now. This is kind of our prototype approach. We're praying that we get a 70 or 80% success rate. But to make sure of that, that's one of the reasons that we're looking at reconstituting the Human Services Committee, because we need an entity for these groups to report out on their progress. And we didn't think the Bridging the Gap Committee was the right entity for that. These folks have a lot of other things to do in their life, and they don't have the authority that the Board of Commissioners do. So that's going to be an important mechanism to make sure that these folks are following through on their contracts. And then, of course, we have millions of dollars in the pipeline still, which means this whole process will start over the course of the next few years. Hopefully with the feedback loop from the things we're doing, we're going to have a sharper idea yet of how to continue to focus resources, and hope that we get, additional proposals that'll be of great value. So any questions on that before I go into the details of the request? Jim?
No, just a couple comments. I mean, I guess one of them, are we questioning at this time some of these expenditures? Because the only one I don't understand on here is the McCullough Vargas and Associates. The rest of them all have a deadline of year or two, year for duration, but on the McCullough Vargas, it says 1 year up to 5 years. If you spent $165,000 in the first year, would there be $165,000 for them the next year and the next year?
No, not as it currently stands.
Okay, so it was just 107. And then I just want to thank you, Commissioner Collins, Francine, speaking on behalf of this committee, because I served on the housing part of it, and I want the people to understand that it isn't that when we say that we didn't want any part of housing, it isn't that we didn't want to look at how housing might support the system from other organizations. It was that we don't want to own a building for housing and moving it forward, and that's what put us together with this second committee to see what some of the other areas are. And I'm going to watch very carefully, because I like the human services idea and them coming in to report, because we need to monitor these to make sure that, I mean, there were a lot of good proposals. You guys did a great job of analyzing them. Now we got to make sure that they're supporting what they said they were going to do with the amount of money that we're giving to them. So I just appreciate the committee. The committee just did a wonderful job.
Can I give feedback on that? For your second portion of to monitor, one thing that was crucial in the RFP that came through in every of the presentation was what was the sustainability in the community. Because the intention for Lenawee County wasn't to put an RFP of a one and done that you received the money, right? Is what is the sustainability? Because that's going to impact the community more than anything. So that was something that was apparent in the RFP, and hopefully will be in the contracts as well, as that sustainability, because that accountability and reporting is going to be important. Is this going to be sustained? And I believe Commissioner Collins asked that several times. What is the sustainability going to be in this program?
Great, thank you.
And I would add that with respect to housing, it is a value for many of the people on the committee, but we understood it would take a tremendous amount of capital, and it's a struggle to maintain that for the long term. And what we said to some of the proponents is, over the next few years, if you can find a group of stakeholders and a pool of assets that can be committed towards something like this, it's certainly something we might look, at least investigate the option of partnering with them, but to commit a huge percentage of these resources to that area was not something that the committee felt committed to, but we certainly value the concept and the need. Anything else before I explain the proposal? Thank you, Francine. I
Thank
appreciate
you.
it. So we have a host of these proposals, and they vary in dollar amounts. Some are $45,000, some are hundreds of thousands of dollars. Some might need their funding up front. Others, it would be obvious that we would want to distribute over time. Rather than bringing 8 or 9 contracts before us and working each of those out one at a time, what this proposal is recommending is that we appoint well, I'll just read this out loud. This action ensures the timely and efficient allocation of funds to qualified programs that address identified community needs through the Bridging the Gap initiative. Granting negotiation authority to a designated team will streamline the process while maintaining appropriate oversight and accountability. The Bridging the Gap Committee requests approval from the Lenawee County Board of Commissioners to fund selected programs that have completed the RFP process. The total funding allocation for these approved programs shall not exceed $1.5 million. Additionally, the committee requests authorization for a negotiation team consisting of Board Chairman Van Doren, Commissioner Collins, Commissioner Martis, and County Administrator Kim Murphy. This team shall be granted authority to negotiate final terms, scopes, and funding agreements with selected program applicants consistent with board-approved funding limits and county policies. Funding for approved programs will not exceed $1.5 million and will be allocated from the opioid settlement funds. So the request is, we recommend that the Lenawee County Board of Commissioners approve the funding of selected Bridging the Gap programs not to exceed $1.5 million and authorize a designated negotiation team to finalize the agreements. Is there a motion to that effect?
Support.
Okay, comments? Commissioner Stimson.
Just so I'm understanding what that motion means. That group of people will then be required to authorize only the contracts of the approved proposals?
Yes.
So 2 years from now, if company XYZ comes forward, this is not an approved person who can come forward.
That's correct.
Additionally, it would be for only an annual year because all of these proposals are for 1 year, that the renewal of it in a year wouldn't just automatically go to that subcommittee.
Were not some of these proposals 2 years in length? Yeah, so some are 2 years.
On this, I see only one that said beyond a year, I thought. Did I miss that?
There's more than one.
Francine, do you want to come back up?
And I've got a whole bunch of other questions. Is this something we have to vote today or can we review the actual proposals? I'm sorry, there was Catholic Charities and Youth, U-Turn Health were also 2 years, I apologize.
Right.
Does this have to be today? Because I haven't actually read any of the physical proposals because they've never been provided to me. And so this is $1.5 million of taxpayer money coming in through the opioid settlements, a third of which seems to be going to a private company that the courts don't use any longer.
Well, I would say that all the proposals, were they all in the packets over time? So all the proposals have been available on the Bridging the Gap Committee packets.
But I'm not on the Bridging Gap Committee and neither are most of the people in this room. And so is there any reason we can't delay a month so we can review those proposals? I can read the actual proposal for what they're going to do for youth intervention in a school, as it's been something that's been dealt with on a regional and state level for the last 10 years, specifically with substance abuse. Ralph and I sit on that committee and we've been dealing with the in-school use of that aspect of some of their programs. I want to see how that works, but I've never seen those proposals from Parkside. And particularly with our court system moving away from Parkside because of some of the concerns they've had. I just want to see how we're going to measure their outcomes and things of that nature. And I don't think we're harmed by waiting a month so that we can read all that.
Commissioner Van Doren.
I understand that, David. One of the, and I'm not sure about waiting. I mean, what time period are we looking at here?
Month.
A month to take a look at it, because the one thing we do want to do is this money's been sitting here for how long?
It's been slowly trickling in over the last year and a half, 2 years probably.
Go ahead, Francine.
Since 2023, actually, we received money before I arrived in May of 23. So
Yeah.
it comes in until 2040 and that keeps building with the new settlements that come through. Lenawee County, I think we're at 5.7 million that will be coming in, but that'll be more when we finally get a couple of the larger settlements.
Anyway, so we just want to get this thing up and moving because we've, had that one committee for housing that took up 12 months and then we appointed this committee that's taken another 12 months. But, and I think part of what you're looking for here is the evaluation and recommends that, those aren't in their contracts, are they? How you're gonna measure it? Isn't that part of the negotiation of the contract?
Well, that's it. We have their proposals, but then we need to go back with them and negotiate things like, okay, you wanted $200,000. We're not going to give you that up front. We think that should be distributed to you quarterly, and that needs to be added into the contract, the final contract. One that was 45,000, however, which includes kiosks and mailers and Sharps containers. Of course, that would make more sense to fund up front because virtually all their money is going into hard deliverables. So because each one has those vagaries, we thought it might make sense to have a team of commissioners and Administrator Murphy resolve those final details while staying inside the budget approved here. Commissioner Collins.
This committee was tasked with the job of receiving these presentations, receiving these programs, and making a decision that we were to bring to this board. We have done that. To say in a month's time that you're going to go through 26 proposals and the information from 26 proposals and not have the benefit of a hearing from the individuals who make those proposals, I think is being unfair both to that committee and to this board. You'll not have time to do it in 1 month, 2 months. I don't see that happening.
Any other comments? Commissioner Stimson.
I think my request is simply to see the proposals that are being requested to be funded so that I can understand their measurables, so that I can report out to my constituencies what that's supposed to look like. And so I don't think something that's taken almost 2 years is harmed by allowing those proposals to be disseminated, the recommended proposals, and allow us to read those so I can ask questions about that, Terry. I'm not trying to second guess the committee. I'm not trying to say that they're right or wrong. I'm just simply saying I'm looking at a third of the funding going to one agency, a private agency, unlike most of the other ones, which are all nonprofit agencies. That knowing that owner of that agency and the size of that agency, that probably makes up a 50% of their total budget, maybe. I mean, that's a huge increase to a small little agency. And so I just want to know how they intend to track parameters like outcomes, which has been something they've struggled with in other programs. So I'm curious, as a person who's about to approve a $1.5 million of funds to a private company.
Any other comments? Commissioner Van Dorn.
And I hear you, Dave, but I have to, and agree with Commissioner Collins here to some degree, because we were hopeful. I mean, these reports were coming back to you every month when we were having a meeting with Bridging the Gap and asking if there was any questions. And each time they were doing that, the proposals were put into the packet, and we were hopeful people were following along because we thought exactly that. I mean, it's going to be one thing to appoint this committee and have them come up with a recommendation and then negotiate how we're going to measure that and move forward to make sure they're moving it forward and not have everyone coming in and second guessing how we could spend another 6 months on this if we go back and review it and people have all kinds of questions. I mean, I think that's what we expected the committee to do, and we expected people to follow along as we were going. So.
And I think the concern about their performance will be addressed in the verbiage of the contract, because we will be monitoring that. And if we see performance issues, we will have contractual authority to take up further discussions with those providers at that time. So we have a motion and a second on the floor. All in favor signify by saying yes.
Yes.
All opposed, no.
No.
Motion carries. Thank you. I think the next one's simpler. We have before us a request to approve an ongoing contract with Madison Schools for a school resource officer to the Board of Commissioners. Is there a motion to that effect? And moved and supported. Any discussion? Ralph?
It's a full-time position?
I don't know. Let me see.
We went through
Yeah,
this over a period of years in substance abuse, and there was times when those committees did that, and then there was other times when they were questioned. As funds become less available,
it was a little hard to get done, but in the end, we got in substance abuse of Livingston, Washtenaw, Lenawee, and Monroe to where that just certain area was non-existent. So, you know, I wonder how much the request is for, or whether it's full-time.
Well, understand that the motion in front of us, or the proposal in front of us, is for a school resource officer, which is not tied to the funding with the opioid settlement, if that's where you were asking.
No, I'm looking at it from a different standpoint. You got a research officer. I want to know what he costs.
Less fair. Commissioner Stimson.
The contract is one of our, all of our other kind of contracts, Ralph, with our supplemental police force that we do. This is a school resource officer contract with Madison Schools for 1,560 hours minimum per year at the rate of 55 and change, which is our, I believe, regular rate. So it's just like we have with Britain, or just like we have with Deerfield, or I don't remember all the contracts we have. There's a half a dozen of them like that. It's not what I think you're driving at, is the old like DARE officers that we used to have, which are closer to the opioid monies that came through substance abuse funding.
Anything further to add to that, Sheriff?
That's absolutely correct. It's not for a full year. It's for the school year and then a little bit over that. So we've had this contract ongoing, and it's something, we have a great relationship with Madison Schools and the superintendent, and it's just to continue that. In today's day and age, school resource officers are invaluable when it comes to making sure that we keep our kids in Lenawee County safe.
Troy, just tell that to my wife next time you see her. It's absolutely correct.
Any other question? Do we have a motion already? Yes, okay. So any further, is there a motion, Carissa? Okay. Oh, that's right. Commissioner Stimson made the motion. I remember. Okay, any other comments? Thank you, Sheriff. Hearing none, all in favor signify by saying yes.
Yes.
Opposed, no. Matter advances. Is that, okay, no worries. Next matter in front of us is, that we approved in the capital improvement plan, a plan to renovate the control center in the county jail that was completed within budget, but did not include upgrades to the security system that operates all video systems in the jail due to the large expense. Captain Casey was able to negotiate much larger work areas without additional cost to the CIP project. Because of that enhancement, the stage was set to upgrade the security system at a cost of $24,414 if the funds could be obtained. Captain Casey then applied for an RAP grant through MMRMA for the funding. The sheriff's office was able to secure that grant for the equipment without the need for a payment plan. Additionally, the dual review policy is not applicable since the grant award is equal to the associated expenditures. So I would ask for a motion to recommend the authorization to spend $24,414 from the grant to pay Securitas for the upgraded security equipment to the Board of Commissioners.
So move.
Support.
Any questions or comments? All in favor signify by saying yes.
Yes.
Opposed, no. Matter advances. Okay. Next, the Material Management Planning Committee requested RFPs for a consultant service, and Commissioner Stimson, this is being driven largely by state policy, correct? Okay. Pursuant to Eagle guidelines, the Materials Management Planning Committee received 4 bids and has recommended HDR Michigan Incorporated. Funding for this will come from the Eagle grant. So I would entertain a motion to recommend to enter into a professional engineering and consulting services agreement with HDR Michigan for the implementation of Lenawee's material management program to the Board of Commissioners.
So moved.
Support.
Moved and seconded. Any discussion? All in favor signify by saying yes.
Yes.
Yes. Opposed, no. Thank you. I'm sorry.
Just voted no.
Okay, just wanted to be clear.
It's fine.
Okay, thank you. And then we have the item that was added into the agenda. The Emergency Management Department has been awarded 2 grants by the Michigan Public Safety Critical Incident Mapping. The first grant in the amount of $12,531 will be for Adrian College Mapping Project. The second grant is in the amount of $12,089 for a Lenawee County Building and Hospital Mapping Project. I'd entertain a motion to recommend accepting these two grants from Michigan Public Safety Critical Incident Mapping Competitive Grant Program and to authorize the board chairman to sign it to the Board of Commissioners. Do I have a motion to that effect? Oh, Administrator Murphy, please.
Before the motion is made, one of the things that we are going to be doing with the action request forms is wherein there is new revenue that is coming in that was not included in the budget, which would result in budget adjustments like those that you saw earlier today. We are going to be creating a form which will allow you to, at the time that you make the motion to, in this example, to approve and recommend signature, you could also at that same time authorize the recommended budget adjustment, so that we don't have to track that later and we can actually kind of
Right.
keep current with our financials. So I would like to add to this, this came in last minute and I apologize, it's not on here. But I would also like to add to that motion and authorize the appropriate budget adjustment.
Okay, so the request is to recommend accepting the two grants from Michigan Public Safety Critical Incident Mapping Competitive Grant Program and to authorize the board chairman to sign it, including the necessary budget adjustment. Is there a motion to that effect?
So did the person that make the motion approve that, or are we
Oh.
going to add that as an amendment?
Oh, there, yeah, Kim stopped it before the motion.
Okay.
So we have a motion from Commissioner Ongst and a second from
Support.
Commissioner Blanco. Any discussion? Seeing none, all in favor signify by saying yes.
Yes.
Opposed, no. Thank you. Is there any other ways and means business? We're going to move on, and we have a resolution that I guess is going to be on the consent agenda for tomorrow, but we will vote on it today. And I will read this. This is a resolution commemorating National County Government Month, where it says, whereas Lenawee County provides essential services that support the health, safety, and well-being of its residents, and whereas counties serve as vital partners in implementing local, state, and federal programs that impact daily life. And whereas Lenawee County and all counties take pride in our responsibility to protect and enhance the health, well-being, and safety of our residents in efficient and cost-effective ways. And whereas the nation is celebrating 250 years of independence this year and counties have a long and rich history of serving residents. And whereas each year since 1991, the National Association of Counties has encouraged counties across the state to elevate awareness of county responsibilities, programs, and services. And Lenawee County continues to promote transparency, public service, and community engagement. Therefore, let it be resolved that the Lenawee County Board of Commissioners do hereby proclaim April 2026 as the National County Government Month and encourage all county officials and residents to participate in county government celebration activities. Do I have a motion to that effect?
Or
Moved and supported. Any comments? I would ask if we would, if Ms. Subke would call the roll.
Commissioner Collins,
yes.
Commissioner Daly,
Yes.
Commissioner Krasny,
Yes.
Commissioner Martis.
Yes.
Commissioner Stimson, Commissioner Tillotson,
Yes.
Commissioner Van Dorn,
Yes.
Commissioner Ongst,
Yes.
Commissioner Blanco,
Yes.
9 yeas.
Thank you. The proclamation passes and it will be on our consent agenda tomorrow. Any other business before I move on to public comment? Seeing none, is there any public comment? Well, please, if you'd come forward and state your name and which township. And you have 3 minutes, sir.
I'm Mike Smith, Rollins Township. And back in 2016, there was a vote put out to have a special tax assessment on properties for Posey Lake for weed control. And it was good for the first 5 years. And since then, people have been requesting natural weeds on the lake to be sprayed so they have nothing in front of their house. And they expect the whole lake to pay for it. And right in our contract, it states that if you want to request, you have to go through the Drain Commission, and they have to report to the weed company in Grand Rapids, Michigan. It's not being done, and at the present time, the people aren't being asked to pay extra for what they want. They expect 236 people to pay for it, and it's been brought to the Posey Lake Weed Board, and with no nothing. It's just they shrug their shoulders at you like you're not here. And I would like somebody that isn't on the board to look into it. At the present time, according to Mike, I can't tell you exactly because there's a certain amount of people get sprayed and then some people don't. Well, at the present time, there's $60,000 to $90,000 that should not have spent for the weed control. And that's all I have to say. I have everything that I said in writing, from 2016 on. I have one person that said he took it upon his own. He is not on the weed board. And he's the one that's been calling up to, Grand Rapids and requesting this for people. And I got people to sign that don't want certain things sprayed. And we were told to be we weren't going to get them sprayed. That's all I have to say. I just hope that I can get through to somebody and get some answers because it's not being handled. And $60,000 is not minor.
Thank you, sir. We appreciate that. Thank you. Any other public comment? No other public comment? Any commissioner comment? Commissioner Van Dorn.
Yeah, I'd just like to acknowledge Craig Tanis and his work that he did on those two grants. I was going to do it at the time and I didn't get there, but that's the one thing that our people are so good at here in Lenawee County. We have great employees and they're always looking for additional funds. And Craig reached out for these, didn't know if he could get them or not, so they weren't in the budget, but spent the time to put them together and they came through. So thank you, Mr. Tanis, for that.
Thank you. Any other comment? Seeing none, I'd entertain a motion to adjourn. Moved and seconded. All in favor signify by saying yes.
Yes.
Opposed, same sign. Meeting's adjourned. Thank you.